Our next speaker is my colleague, Laura Atherton from the Milk Bank at Chester. And Laura joined the Milk Bank team in Chester in 2018. And she's one of the team coordinators there that recruits, screens new donors, and organizes milk collection, as well as dispatching milk to hospitals and ensuring that all the milk depots that they work with are regularly restocked with pasteurized donor milk. She's also the administrative support person for UCAM, and she has been a key driver behind the Memory Milk Gift Initiative, which the Milk Bank at Chester has set up, and which she's going to talk to us about today. And this includes, as she will tell us more about, families' choice to include their babies' names on hand-printed memory milk trees in their milk bank. And this is work that we're working with UCAM and Debbie Barnett and myself and others to make this initiative more widely available across the UK. But I'll turn over to Laura and she'll tell us more now. Laura, please go ahead.
Thank you very much. So today I'm going to be talking to you about milk donation after loss in the UK, how milk donation currently works, and the improvements that we make.
Are you able to share your screen, or do you want me to share?
I can, yeah.
I have your videos as well, Laura, if there's any problems. Yeah.
Okay, fab. I might need the support with the videos.
Okay, great. Sure.
There we go.
Perfect.
So I want to talk about the improvements that we can make when we work collaboratively across all settings. So between milk banks, hospitals, hospices and families. When we work together, we can make the necessary changes so that all families are offered choice in the care after death of their baby. Here at Milk Bank Chester, we believe that every family across the UK should be given the choice to donate milk in memory of their baby. Today, we bring to you our mission statement, one that we hope will inspire neonatal units and bereavement teams across the UK to routinely offer milk donation after loss. Following feedback from bereaved families who donated during the pandemic, we became more aware of the importance and the benefits of donating milk after loss. This led us to review the service that we offer to the families who came to us. We want to ensure that donors are offered the best service at the worst possible time. The initiative is guided by the feedback that we've actively seek from donors and the health professionals that support them. I've missed the slide, I apologise. Not all milk banks can accept donations of donor milk from bereaved families, and there is so much that we can do to improve nationally. Having carried out a survey of UK milk banks, from those who replied, it's clear that there are huge discrepancies of how donation after loss are received and recognised across the UK. Of the 8 milk banks who replied to the survey, all agreed that they would accept milk donations from a bereaved donor if they felt it appropriate to do so. The good news is that if they were unable to accept a donation, all agreed that they would direct donors to other milk banks. Almost all milk banks agreed that they would accept a reduced donation amount from a bereaved donor. Only 2 offer bespoke options for memory making, something that we believe is really important, and only 1 milk bank offered personalised memory making opportunities. The same 2 milk banks also offered opportunities for family to donate where factors deemed incompatible with donation to babies are in play. For example, when mum has taken medication, milk could be used for a suitable research project or for in-house quality control, of course with family's consent. 1 family a month donates to the milk bank, predominantly through referrals from neonatal units and bereavement teams that we already have strong working relationships with. However, some of our donors have stumbled across the concept of milk donation and have had to seek out appropriate advice to self-refer. Donation after loss is not offered in many units as routine. Every family's reason behind wanting to donate their baby's milk is unique, but the overwhelming theme is that they want to do something to try and help prevent other families going through their pain. I always hoped baby would be a light in this sometimes dark world, and even in his passing, there's a chance yet he could bless more than just my family and friends' lives. You will hear more from Holly Bodhi's mum, later in the presentation. But this beautiful quote sums up one of many reasons why a family may choose to donate. Milk donation after loss presents itself in many different ways. Families may donate milk that they had expressed for their own baby who was receiving care in a NICU or SCBU environment, and this is the most common form of donation after loss. Families may decide to continue to express following the death of their baby, and other families have initiated lactation following a stillbirth. It is so important to recognise the importance of an individualised plan for onboarding these families to their donation journeys. We recognise that each family will be at different stages of grief, and what works for one family on one day may not be appropriate on a different day, or indeed for a different family. Francis passed away suddenly in 2019 from complications with a heart defect. Although his family knew about his condition, his death was a terrible shock. Within hours, his mum was ready to feed again. Abby was in A&E and a breast pump was bought from the maternity unit. Abby had recently read about the opportunity of donation and asked the hospital to provide the information. This would not have been offered as standard care. From the map above, you can see that there is a huge area that is covered by the milk bank at Chester. Whilst many of the families are local to us, we are now able to accept milk from any bereaved family across the UK where their most local milk bank are unable to accept their donation. You may recognise the study that we talk about here. It's AILET study, and it's the study of milk donation after losing one's baby. It highlighted 3 main points, and these points above were of significant interest to us. Points 1 and 2, identifying as a donor as a transformative identity, and this identity empowering donors and helping them to heal, were clear positive factors to donation, ones that we had heard about time and time again from our donors. And in fact, we have not received any negative feedback with regards to the donation experience. The third point, bereaved mothers' affiliation with milk banks helped to strengthen their social networks, helped us to recognise that we could do more. We had the opportunity to do more, and we could help to strengthen these families' social networks in a time that is often described as isolating and lonely. This inspired the parent focus group. The benefits of both during and after donating, mums and families both noted significant positive effects on their mental health. This was in the case of donors who were donating ongoing or following a stillbirth, even after some initial concerns from families about whether this would be a positive experience. They felt that it helped them to grieve and also gave them a reason to keep healthy and to maintain a routine. It made sure that they had limited caffeine and alcohol intake, and they kept in a routine of eating well and keeping hydrated. The Memory Milk Gift Initiative. In 2021, donations collected by one of our donors at the funeral of her baby were donated to the milk bank at Chester. Working closely with the donor, the Memory Milk Gift Initiative was developed. We spoke to Mum from the moment the idea was a concept and checked that she was happy for us to use her monetary donation in this way. We spoke with Holly on a monthly basis and asked for feedback all the way along the journey. Mum thought it was also important to see feedback from other families, and so we were able to roll out the first questions for the parent focus group in June 2021. We asked families about their experiences of donation and how we could improve the service. Having a dedicated bereavement lead reduces the amount of times that the family needs to share their story. This was important to the families. I am the bereavement lead at Chester, and I am now a point of contact for both families and the health professionals that support them. It allows us to have a pathway for donation after loss with scope for personalisation, and I have dedicated time each week to review every family and ensure best practice. In August, after posting on our main social media channel, we were approached by a current donor who had suffered a stillbirth at 24 weeks. Mum had said she would have loved to donate her milk in his memory. We were then able to offer Mum the opportunity to donate the milk from her rainbow baby in memory of her baby who had passed away. Personalising the pathway is imperative for these families in the most extenuating of circumstances. I hope that by donating my breast milk, I may have helped prevent another family from experiencing my pain. The professional focus group that we've set up is ever expanding, initially made up of staff from across the Countess of Chester, to now including feedback from units across the Northwest. We also have charity CEOs sat on the focus group, as well as a local GP, and recently joined is a lecturer from Salford University. There is an overwhelming sense of sadness amongst bereaved families that that opportunity for creating moments and memory making is so very limited. By allowing families the chance to donate their milk in memory of their babies, we are allowing them the opportunity to add precious moments to their babies' memory boxes. Here at the Memory Milk Gift Initiative, we offer 4 separate ways for donors to acknowledge their donation. Donors can choose all 4 or any combination of these moment-making opportunities, and all within their own time frame. The cards that you can see on screen are hand personalised with the name of their baby, printed on high-quality card and sent out to donors following their donation. Donors are able to request other copies for family members, and these are the cards that are used for the Instagram dedication squares. The card is an actual photograph of the Memory Milk Gift, which stands at a tree, which stands at a huge 6'6" in our office, and was taken before any names were added to the tree. The Milk Bank logo, which sits on the wall next to the tree, was also removed as we felt it important that this has no corporate feeling whatsoever. These wooden pebbles are hand painted, and on the reverse side have the baby's name painted in white and gold and are hand varnished. The wooden element ties in with the trees, and these are smooth to touch and perfect for memory boxes. Our donors really do love these. They're sent to donors in velvet pouches to keep safe and are perfect to go in the memory boxes. I'm going to try and get this link to work. I have been having some problems, so I apologise if this doesn't go to plan.
I have it ready anyways, Laura, if need be.
Okay, fab. Oh, I think I might.
I'll swap over here just 1 second.
Okay, thank you.
Oh, sorry. Am I sharing? I am sharing, yes.
So this is the memory milk tree. More names have since been added to the tree, and consent has obviously been gained from all donors to share this video on our social media channels and for purposes of raising an awareness of donation after loss. Oh. I'll just go back to sharing my screen. When George was born, I had to express milk which we could feed to him through a syringe. When he got poorly, he was put on nil by mouth, so the hospital froze my milk. Then, when George passed, I was asked if he'd be willing to donate my milk to the milk bank, which give milk to babies whose mums are poorly or can't produce their own milk. I said yes, and a few weeks later received a little pebble with George's name on and a thank you letter. Last month, I got an email from the milk bank to say they were having...
I'll just share the slides here again for you.
Thanks, Justin.
No problem. There you go. Can you see them okay, Laura?
I can't see anything now. I think I've just done my... hang on 1 second. I've lost... There we go. Are you sharing this screen?
Yeah, you can tell me when to advance if need be.
Okay. I got an email from the milk bank to say that they were having a memory milk tree painted at the Countess of Chester Hospital where they are based, and did I want George's name to be added? Of course I said yes, and here it is. I'm so happy that people other than us remember George and talk about him, even though no one was able to meet him. The post above is exactly why the Memory Milk Tree Gift Initiative is so important. The positive impact that the project has had on the donors shows exactly why our mission statement should be rolled out across the country. Oh, next slide, please. It is our duty, however, to recognise our limitations. We are not trained in grief counselling or as mental health professionals. We do, however, have regular contact with some of our bereaved donors for prolonged periods of time. Being able to signpost for support throughout their donation journey, however long or short, is important. And we're working closely with a local GP and national charities to ensure that this happens. It is also imperative to ensure that we work closely with the donor, and when it is time for their donation journey to end, to ensure that we have taken every step that a dependency on milk donation has not been created. We have added a list of national charities to our website, which can offer support following the death of a child. Feedback from Francis's mum, Abigail, was that she would also like to share information about Francis if people would be willing to hear about the donor's children, about his personality and why she chose to donate in his memory. At Memory Milk Gift on Instagram has become a place where donors can share their story in their own words, as every family is offered a dedication square. Donors past and present have started to interact via the page and their shared experience of donation after loss. Memory Milk Gift on Twitter is seemingly becoming a place where health professionals and charities are interacting with us and is a great platform to share our mission statement and nationwide goals. Softer branding across the initiative is important to us as it takes the focus away from the milk bank branding, while still offering the assurance that we are offering good NHS service. It demonstrates to our donors and our colleagues across the NHS that the donors are at the forefront of what the Memory Milk initiative offers. It also allows the Memory Milk Gift initiative to be easily identified as a safe space for bereaved families. The logo is discreet and labels on the outside of envelopes gives the donor an idea of what the correspondence is regarding. We recognise that there are times, if we just go back one to the website and there we go. The logo is discreet. We recognise there are times when contacting a bereaved family via telephone or email is not appropriate, especially if the family isn't expecting contact. And by identifying our post discreetly, it allows families to take a moment if required. So you can see our website here. This is our home page. And the initiative now holds a prominent position on our website with a button that takes the viewer straight to the relevant information. This makes sourcing the correct, up-to-date information easier to access for both families and health professionals, and means that bereaved families are not trawling through pictures of healthy babies. Next slide, please. Increasing awareness of donation after loss is one of our main objectives. In order to do this, we need to provide the information to units and make ourselves available to spend the time building these relationships. Another benefit of having a bereavement lead in position, we have a database with all relevant contact details on so that we can contact our colleagues by name. All level 3 neonatal units in the Northwest, as well as Alder Hey, have now been sent bereavement packs. The plan is to send these packs out to all level 2 and SCBU units so that every hospital is equipped to offer the choice of donation. Each unit is also invited to meet with us either in person or via Teams, and we're looking to implement a champion scheme that units can sign up to. The units have been sent a pebble, a print of the tree and the leaflets, along with screening forms and the information on our website. Once a unit has signed up to offer milk donation, we can send them blood postage boxes, which means our donors can have their bloods done on site without the added stress of having to visit a GP or return to the hospital to get their bloods done at a later date. We want to further continue our work with charities across the country. We've had great communications with several charities so far and excited to see where these budding relationships can go. By delivering weekly sessions at the Northwest Neonatal Operational Delivery Network, the palliative care training alongside Alex Mancini, we are extending our reach hugely. Alex also provides all the neonatal staff with the information side and our contact details so that if they do make contact with a family who wish to inquire about donation, they know where to go. Thinking outside the box in these situations is imperative. Recently, we were contacted by Clare House Hospice with a mum who wished to donate. This was the first time we had worked with a hospice. We had meetings with the staff member who was looking after the family when we realised that the mum had been taking medication which was not compatible with milk donation. We then had a discussion about other options and offered the family that they could donate their milk as part of a trial so that staff at the hospice and blood bikers who collect the milk could trial the recruitment, collection and process of milk donation so that other families could use this service in the future. The family were delighted with an alternative that meant they were still able to donate the milk, and we now have a positive relationship with a hospice that we didn't before. Next slide, please. Thank you. The feedback from health professionals broached with the topic of donation after loss appears to be predominantly when. When do we broach the topic? When the donor has already been told life-altering news. They're already being given a huge amount of information, as well as going through extreme trauma and have a huge emotional and physical journey ahead of them. The obvious answer to us was to go to our parents and ask them the question. To our bereaved families, both those who had donated and who hadn't been given the opportunity to, the answer was blindingly simple. If the question is being asked about lactation suppressants, then the alternative can and always should be offered as standard. Oh, if we can go to the next one, please. Liverpool Women's Hospital is one of our local level 3 units. They routinely offer donation after loss, and as such, all families are offered a choice. All their families are offered a choice that all families should be offered. Fawzia Pays is a consultant neonatologist. We're a keen supporter of this at Liverpool Women's. We have a checklist that reminds people to ask women if they want to carry on donating their milk after loss and do their bloods on site. We work closely with that Milk Bank Chester to maintain procedures. This is so important for families. Oh, if we can go to the next one, please. So our future plans. The initiative doesn't stop now. We still have lots of work to do, and continual service improvement is a huge part of what the initiative stands for. Whilst our paperwork has all the new memory milk gift branding, our bereavement leaflets do still need to have the logo added to them. We didn't think it was right for the environment to discard hundreds of leaflets that had already been printed. However, we're now down to our remaining few, and these will be updated. We're keen to ensure that health professionals working with families are fully trained. We would like to be able to signpost Milk Bank staff to relevant training, and are undertaking several training sessions to ensure that we are recommending useful sessions. Here at Chester, we are lucky that all of our staff undergo basic bereavement training from SAMS as standard. This is not the case across UK milk banks, and yet we feel that it is important for both the families and the self-care of the health professionals and milk bank staff. Oh, can we go to the next one, please? We're delighted to be working in partnership with UCAM to hopefully engage all UK milk banks to sign everybody up to the mission statement. Working collaboratively, going forward, we hope to commission 2 more memory milk trees, one in Scotland and one in the south of England. Emails will be going out following the presentation to milk banks to ask them to join to work with us and families, so that all families across the UK are being offered the opportunity to donate after loss as routine. Together, we can ensure that these families are being offered the choice that they deserve, and that we acknowledge these donations with the compassion that they deserve. Finally, I'd like to finish off with a short video from one of our donors, Holly. This is Holly and Bodhi's story of donation after loss.
Yeah.
He was stillborn. Whilst in hospital, no one told me or explained to me that I could donate my milk, something that my body was going to start producing, because even though my son had passed away, he was still going to be born, and my body thought that he needed to be fed. Whilst I was waiting for the induction medication to work, which takes 48 hours, I started doing some research about baby loss, about what my body was going to go through. And somewhere I stumbled across the fact that I could donate my milk. That I could donate Bodhi's milk. Straight away, I knew it was something that I wanted to do. I wanted to do in his name. I wanted something that I made for him to go to other babies, to help other families not go through what I was going through, what I have gone through, what I still am going through. All the hospital did was offer me medication to stop my milk. And to be honest, when I told them that I was going to donate my milk, some of my family and some of the consultants and midwives, they were concerned for my mental health. But actually it was the best thing for my mental health. It gave me a reason to look after myself in a really dark time, when otherwise I'm not really sure what I would have done. Who knows? Maybe donating milk in a way saved my life. because it really did make myself cook myself meals and, you know, be hygienic. Little things that most people take for granted, but when you're going through grief, it doesn't come naturally to want to look after yourself. So I'm really grateful that I came across the milk bank at Chester, because I tried a few other milk banks before, and none of them wanted to work with me. In fact, one of them said that they couldn't offer me the pastoral help that I needed. No one needed to give me pastoral help. I was going to be grieving regardless. Still am grieving, will be forever grieving. I just wanted to donate my milk. I wanted to donate Bodhi's milk. I wanted him to leave a positive mark on this planet, like I always had hoped that he would. And through my milk, through his milk, through donating with the milk bank at Chester, his name lives on. He is a little light in a sometimes dark world. His milk helped potentially hundreds of families not go through the pain that I still go through. I just want hospitals to inform all families of milk donation. And even though it seems like a really hard thing to do when a family has lost something so precious, actually it can provide a little bit of hope, and that you don't always have to tread on eggshells. Sometimes a bit of information can really lift a shattered heart just a little bit, like it did for me. So thank you for listening.
A fairly good place to end. I think Holly's words are really powerful. So thank you for listening. And anyone has any questions?
Thank you, Laura. Thank you so much. And I agree. Thanks to Holly and for everything that she did too in terms of telling her story. Okay, I'm trying not to cry. But you know, she made a really wonderful point about which mothers who have gone through this grief identify with, which is it doesn't stop. We change. We learn how to live with these things. And for some people like Holly, it can be a wonderful thing to be able to donate with that. So it's wonderful what you guys have done. We've got, I'm going to look here if I can read the questions and stop crying. So people are pointing out how wonderful the video was, and people are thanking you for your work that you guys are doing and the work that we're going to keep doing. And they've also pointed out, Debbie's pointed out that we're so thrilled that UCAM is going to be involved with this. And I hope that at one point, maybe there'll be one of these trees in Ireland as well. Well, the north is in the UK, maybe in the south too. So we'll have it as a cross-border consideration. So
that'd be lovely.
So we, in terms of thinking about these things, maybe we could take a short break, unless Elliot, you had something you wanted to ask Laura as well, because I'm just finding I'll have a drink of water. And Elliot, are you there?
Second, yeah, I just wanted to unmute. I want to thank you so much, Laura. It was very interesting and very moving, and I don't see the participants, but I guess that there are some people who works in hospitals in other countries in the world, except for United Kingdom. And I think the things that for me was very important to take from your presentation is the perspective that others sometimes have, that if a woman will express milk or would be engaged in donating after loss, she will harm herself, maybe like, you know, she will induce her hormones, she will do all kind of things that they're not, or looked at her like Holly said in the videos, like a mental case. And I think it's very important for us as scholars to keep raising the voices that saying, no, it's really it's a healthy decision, and it's a health, and it has a healthy outcomes, and not just physically, but also for our for the physical situation. You know, it's just not just the mental health of the bereaved, but also for her physical health. So I think it was very important, and I just want to make sure that if there are nurses here or somebody who, you know, we can maybe start provoke those kind of thoughts and start. I know that not all of you, and if you are here with us, then you're probably on our side, but still it's something that it's
Tanya,
okay.
there's actually Nick Embleton has put a really.
I was just going to say that Nick had a question. That's great, Debbie.
Yeah, and I think
actually I was wondering if you wanted to chime in about that question, because you would have more information about that as well. So.
Well, so Nick Embleton has asked a question about the lower gestational age for stillbirths, and obviously he's asking Laura in particular about if they've had much success engaging with midwives and obstetric teams. And certainly I'll just say very quickly that we did some work with SANS in Scotland, and we certainly have had some mums where they have chosen to donate with what I would call, you know, fairly low gestational age. Some mums around 22, 23 weeks. Few, but there have certainly been one or two. Again, I think what Laura, in fact, all the presentations so far have communicated is that sharing the information is really challenging, and certainly the work that Laura is doing, I think, through some of the networks, is what we would like to replicate more widely with UCAM, tapping into those other networks that we have across the country. But Laura, have you got any comments on kind of reaching out to those mothers who may have had kind of lower gestational age losses?
So no, again, it's about reaching out to the units and having those conversations, and I think that the work that we're doing, we're trying to get it into BFI training. We are trying to speak to the units. The fact that we've made links with Salford University is great, because they're rolling it out as part of their postgrad. So the main barrier that we're up against is how to share that information. We do have quite a few donors who are currently donating. We've got a current donor who is donating. Her baby was born at 22 weeks. Baby is still very poorly, but mum is choosing to donate ongoing. And I think if you've got a unit that is engaged in milk donation and as a whole, that message gets passed across much easier. But that's definitely an area that we want to move into.
That's a wonderful point, Laura, in terms of thinking about education and communication. And, you know, that's part of the reason why DCU is involved with the webinar today. And, you know, I'm sure lots of other places in the future will want to be involved, particularly as UCAM works with you more and we develop these things more. So I think these are wonderful things, and I appreciate so much what you've done. I was thinking we could take a 10-minute break though, and then we have 2 more talks. And but I'm conscious that some people might need to go and grab a cup of tea or something else and come right back.